October 16th, meeting Azalea Health at Lunch webinar. We were having a few technical difficulties with sound. Please alert us if you're having any issues, and we'll try to follow up on that. We have joining us today, oops, now my speaker won't, there it goes, Ashley Allday, who's a project manager with Azalea Health. And she works directly with our clients, especially with meaningful use to ensure successful implementation. And Ramin Hazad, who is a channel manager for Azalea Health. He also works directly with the clients and offers a great amount of experience in the industry. Today we're going to cover Stage 2 meaningful use. We all know it's been extended through the end of 2016. What are the Stage 2 requirements? What do you need to know about Stage 2? And Azalea Health received its ONC ACB certification from Drummond and the significance of that. Big question you all have is, are you eligible to start Stage 2? Medicaid versus Medicare, the hardship exception, and then we'll have some resources for you. And then we're going to open it up to questions. All right, let's jump in, get started. All right, Ramin, first of all, welcome to our webinar today. Briefly, let's look at Stage 2 meaningful use. We know it was extended. So briefly, let's jump off with that high level.
Yeah, well, thank you so much for having me join today. So with Stage 2 being extended, it's really going to give practices an opportunity that we're either lagging or a little behind, a little bit more time to be able to complete the information that needs to be collected. So this is a really big deal that practices need to take advantage of, and it gives everyone a little bit more of a grace period to complete Stage 2.
Great, thank you, Ramin. I was just checking our sound quality, and it looks like we're all good now, thankfully. So moving on, let's jump in then. Ashley, are you on board?
Yep.
All right, thank you for joining us today.
Certainly.
And Ashley she has been out there on the front line for us working on meaningful use. Okay, so first of all, what do eligible providers, what must they meet? And Ashley, I'm going to let you take off on that.
Certainly. For the Stage 2 requirements, eligible providers must meet 17 core measures. So they'll need to meet all 17 of those core measures. 3 menu measures. So they will have the opportunity, if you're using Azalea software, you can use 3 of the 4. You can choose 3 out of 4 menu measures. And then also you'll need to report on 9 clinical quality measures that cover at least 3 different domains. And customers can actually access all of this information from our help by clicking the help link when they're logged into the software. And we have outlined a step-by-step instructional guide with exactly where these core menu measures are documented in our software so that they can easily know exactly where to enter that information in order to meet these Stage 2 requirements.
So Ashley, if I was a physician, how would these changes impact me?
Well, some of these changes they're going to impact in different ways. A lot of the actual Stage 1 measures, and a great thing is that a lot of the Stage 1 objectives are actually carried over to Stage 2. So with just actually an increase in the percentage threshold. So the good news is that everything you've done in Stage 1, you can actually do in Stage 2, and you just have to do a little bit more of it. But mainly the big differences is the fact that there's some increased patient engagement. For example, under Stage 1, you were only required to register 10% of your patients with the patient portal. But under Stage 2, you now have to register not only 10%, not just 10% of your patients, but actually 50% of your patients.
Oh.
And then of that 50%, 5% of those patients will actually have to have logged in and viewed their health information online. So it's kind of a different this year in that it's got a lot more patient engagement. The patients will need to have actually logged into their patient portal and viewed that health information.
Also, a great thing, actually, I guess, would be is patient engagement. I think that's really a big push for the future of healthcare. Can you talk about some of the aspects of the patient engagement that we offer in the portal or through Azalea?
Certainly. So in our patient portal, when the patients log in, not only do they have the ability to view their demographic information online and their insurance information, and they can actually, request to update that information from their portal, but they can also log in and view their laboratory results online. They can view their chart information. They can actually capture their own vitals online through their patient portal. So it's definitely a great way to get patients engaged to go ahead and complete that information in their portal before they even come into the office and have to take that time to do that in the waiting room. So it's definitely recommended the patients use.
And I've heard that there's an encrypted chat. So is that something that they can communicate? Is it more like an email, or can you describe that a little bit?
Certainly. It's not so much as a chat where they can actually, it's live chat back and forth, but there is secure messaging. So the patients can actually message their providers or message the front desk staff about an appointment. And it's all secure information within Azalea. So if they have any questions about their health information, they can send messages to their providers through the messaging system directly from their patient portal. Mm-hmm.
So this is a great way to
This is Tamara. I just wanted to comment briefly, also remind our customers who are listening that Ashley has also put together an in-depth meaningful use guide, which is online, and we'll be sending you all an email follow-up with a link to that. Ashley, could you point out also on the screenshot you had on here the significance of the arrow and the help?
Yes, exactly. So not only will we be sending a direct link to that guide, but when you're logged into our software, we have that main menu bar at the top of your screen that you navigate with, and then you'll always see that help link at the top in red, and they can click on that help link and access not only all of our training materials for the software, but also the Stage 2 Meaningful Use Guide that we'll be sending out. So if you missed it in the email follow-up, you can always access it while logged into the software by clicking on that help link.
Great, thank you. Let's move on to the next question we have. And this is still, it's pretty much what we were just talking about. First of all, the people we're talking to, our audience, what do they need to know about Stage 2 that has an impact on their practice?
Exactly.
And I think, Ashley, you mentioned already that much of what was in Stage 1 is carried over. Could you talk to that a little bit more, please?
Certainly. We've mentioned a lot of the Stage 1 objectives are just carried over to Stage 2 with an increased percentage threshold, the increased patient engagement like Romina and I were talking about with the patient portal. And then also there's the enhanced interoperability and health information exchange. Under Stage 2, they've required that the EHRs have all of the information regarding the patient coded in a structured data format that has to be uniform amongst the Stage 2 certified EHRs. So when you're referring a patient out to another physician, this file, as they would call it, a CCDA file, would need to be sent to the other setting of care that you're referring out to in order to meet some of these measures. So that's another difference with Stage 2.
What is included when you send a CCDA to another EHR?
There's actually quite a bit of information. It's a lot more that's required for Stage 2 than Stage 1. They would send not only the patient demographic information and the rendering provider, but also the clinical information such as their any vitals that were taken, diagnosis codes, procedure codes, immunizations. There's a list of required fields that if it was captured in the EHR, they would also need to be sent over in that file.
Yeah, that's an abundance of information that can be shared now very quickly and easily using the Stage 2 certified software, so that's great.
Certainly, certainly.
Right. Thank you, Ashley. And our next question, if you could, we all know that meeting our certification with Drummond was a huge undertaking within our organization. And again, Ashley was at the front line of that for us. Ashley, can you tell us a bit more about that, please?
Certainly. So we just recently this year in 2014 received our Stage 2 certification with Drummond. And just some stats for 2014, only a little over 100 ambulatory EHRs are certified as complete EHRs for Stage 2. And this is a small fraction of the nearly 1,400 complete ambulatory EHRs that were certified back in 2011 for Stage 1. So this is a big deal for Azalea and its clients that we have this Stage 2 certified EHR. A lot of practices out there have vendors that might not be Stage 2 certified or ready, and they're having to look elsewhere at different vendors if they're wanting to become certified for meaningful use. if they're wanting to participate in stage 2.
And being on the sales side, I can let you know that we have been receiving an inbound or influx of practices that have been calling in, inquiring about using a Stage 2 software, being that their current EHR is not certified. So you're going to see a lot of the industry really kind of shrinking with some other softwares, and we are very proud that we are able to offer a great full suite solution to our clients that is certified and that will be around for a long time.
Certainly.
Right, and if people want to get more detail on that, we do have the press announcement, which is strictly regulated by the Drummond Group. It's available on our website as well. Thank you, guys. Okay, now this is where I know we get a lot of questions. When can you start stage 1 if you haven't done it? What's the period between, and when can you proceed to stage 2? Okay, Ashley, can you address this for us, please?
Definitely. A lot of times we have questions from providers where they think, they would just have to go ahead and jump right into stage 2 in 2014. And actually, unless you have completed 2 years of stage 1 first, you cannot proceed to stage 2. So even though it's 2014, if 2014 is your first year to participate, or 2015 and beyond, you would need to start out with stage 1, and then you would complete 2 years of stage 1 before you would proceed to stage 2. So that's just one of the things we wanted to clear up and make sure that everybody understood that you would complete those 2 years of stage 1 first. And then also just kind of a little bit more information on that. If you're Medicare, that first year of stage 1, you would do the 30-day reporting period. And then for Medicaid providers, it would be your first year of stage 1, you actually get to just attest that you have implemented a complete certified EHR. So there is a little bit difference in the reporting periods.
So if someone goes to a test for stage 1, part 1 next year for Medicare, is there still financial incentives left, or is it more of the penalty phase that is strictly still being enforced?
Certainly. Good question, Ramin. Actually, next year, if next year was their first year to begin stage 1 meaningful use, they would actually not be receiving any incentives. This year in 2014 was the last year to receive any incentive payments for participating with meaningful use. Next year, beginning next year, you would strictly be just participating in the program to avoid any penalties from not participating in meaningful use. And then starting next year, it would be, I guess the adjustments or the penalties would start out at 1%, and then they would increase each year after that you don't participate with a maximum of 5%.
And for Medicaid, though, they still have that opportunity to attest not only and receive incentives if they wanted to sign up this year, but throughout the following few years as well. Is that correct?
That's correct, Ramin. So with Medicaid, the difference is that they can actually test all the way through 2016 and still receive incentive payments if you're in the Medicaid program. Mm-hmm.
Great, thank you. Let's move on to the next question, which involves, again, so what is the difference between the Medicaid and Medicare EHR incentive programs?
And we have this chart, and Ramin and I covered just a little bit of it, but there's a couple different differences in that, the maximum payouts for Medicare is $44,000, while the Medicaid is $63,000. Medicare is a little bit more strict when it comes to your years of participation. They have to do it in 5 consecutive years, while with Medicaid, the payments are over 6 years, and they actually don't have to be consecutive. The Medicaid program actually goes until 2021. So as long as they've done those 6 years, they can receive full reimbursement or incentive payments.
Is there any chance that this is going to be changing? Should people keep an eye out for the changes in this?
I always recommend keeping an eye out for changes. It seems that every year there's something different released, a new change, a delay, an extension. So it's always best to keep your eye out when it comes to these incentive programs from the government, for sure.
All right. Thank you, Ashley. Let's move on then to hardship exception. And again, I know we regularly get questions about this. If you can you tell us a little bit about that? And specifically, again, for Azalea Health customers, what do they need to know?
Yes. Originally, there was a hardship application that was due back in July of 2014, and it actually allowed users to be able to file for hardship exemption for multiple different reasons. One of them including your software vendor not being Stage 2 certified or ready in time, but Azalea Health is now Stage 2 certified, so any of our customers who are able to begin their reporting period by October 1st will be able to or are eligible to receive that incentive money. But this exception has been extended to November 30th for anybody else out there who has not had a chance to become, utilize a vendor who's been Stage 2 certified at that point.
Right, and Azalea Health customers, do they need to worry about this?
Exactly, exactly.
They don't need to, right, unless they've already started reporting.
That is correct. So as
Okay.
long as they've got, now anybody who purchases it after, would probably not be able to utilize the exception. But anybody who, any of our customers right now, as long as they've started reporting October 1st, they will be able to receive that incentive money.
Right. Okay. Thank you. Those are our main questions. Before we jump into questions for the panel, I wanted to remind everybody that this webinar has been recorded and it will be available on our website. I'll also be sending out a follow-up email to people who have registered with a link to our training guide, to the 2015 hardship exception application, and to the CMS announcement on 2015 policies. I also want to remind everybody that November 13th, our at-lunch webinar will be on patient-centered medical home. What do you need to know? And we're going to have Dr. Liz Dewey and Justin Pards, noted industry speaker, speaking at that for us, and that's November 13th. You can go ahead and register now if you go to our website. We're now taking questions for the panelists. If you have them, please send them in. All right. I've got a couple of questions here. Ashley, Ramin, are you ready?
Sure.
Sure, okay. All right, first question here. How much in reimbursements do I need to file to receive a maximum incentive? And I guess for Medicaid and Medicare, that would be a distinction.
Okay. For Medicaid, there's no minimal billing amount that's required. You just have to qualify for the Medicaid incentive program, and that just means that 30% of your encounters within any 90-day consecutive reporting period would need to be Medicaid encounters. With the exception of a pediatrician who actually only has to have 20% of their encounters filed during the reporting period be Medicaid encounters. And then with Medicare, you actually need to bill out $24,000 in allowable Medicare charges on your Part B fee schedule in order to receive the maximum incentive payment for reimbursement with Medicare.
Okay, great. Thank you. We do have several questions coming in. Ashley, I think you can help us with this one. What Azalea report would give me the correct percentage of my patient encounters for Medicaid's 30% requirement? Good question.
That is a good question. And actually, I believe that is our encounter summary report. I can actually get back to, if I knew who asked that question, I could get back to them with the definite answer. But I know that we've had to calculate this for people in the past or tell them which reports that they can use to calculate. And I think it's their encounter summary report, but I don't want them to hold me to that answer. I'd rather get the exact answer if I can.
Okay, so I'm going to tell whoever sent us this to contact our customer relations directly. And if you'd like to ask for Ashley, and she can respond to your question in more detail.
Or
okay,
Tamara, if we have a list of these questions that we're asking that I can't give an exact answer to, I can find out and we can send those answers out to everybody after.
And that would be a great idea. I was going to say when I send the follow-up email, I can post some of that information. Okay, next question. If you started Stage 1 in July 2014, do you start Stage 2 in January 2016 or July 2016? January 2016 or July 2016?
Well, if you started Stage 1 in July of 2014, and that was your first year of Stage 1, then you would now need to do your second year of Stage 1 starting January of 2015. because it will need to be done for a full year. And then you would move on to your first year of stage 2 in January of 2016.
So as a reminder, each stage has 2 parts to it. So stage 1 has part 1 and part 2, and stage 2 has part 1 and part 2. Is that correct?
That's correct. You would participate for 2 years under each stage.
Wonderful.
All right, we've got a couple other questions here. Gosh, good questions. Is it true I can reattest stage 1 because they have extended the time period?
Can you repeat that question for me, Camera?
Yeah, let me see if I got that. They put this in such a tiny box, it's hard to read. Is it true I can reattest stage 1 because they have extended the time period? No. Yeah.
Stage 1 can be started, again, stage 1 can be started in any year, so as long as you just complete stage 1 for 2 consecutive years, if it's Medicare, or 2 years in Medicaid, depending on the year. If they started it in 2014, your last day to start to report, your reporting period to begin in 2014 would have been October 1st.
Right.
So yes, you could attest starting October 1st in 2014 for your stage 1.
Right. Okay. Thank you, Ashley. Okay. Let's see. When a provider passes attestation for Medicare in October 2014, does CMS wait till 2015 to pay MU incentive?
Yes, that is correct. So if you pass in October, if you attested from October 2014 for 3 months, you would then need to report all of your attestation numerator and denominators that you have in our system that you pull from our dashboard. You would report that on the CMS site, and that has to be done no later than February of 2015. So even though your reporting period was October 2014 for 3 months, they give you until the end of February 2015 to report on CMS all of those numbers, and then they typically will pay out starting as soon as, for your 2014 attestation, they'll pay out maybe starting, I think I hear the soonest that they start is March of 2015. So you shouldn't expect any payments at least, before the end of March for your 2014 participation.
Okay, I've got another question here. It says, I attested last year for stage 1 with Medicare. So I need to repeat stage 1 again?
That's correct. You would need to do 2 years of stage 1 before you can proceed to stage 2.
Ah, okay. All right, great. Oops. Okay, some technical questions. All right, does Azalea do the reporting or the individual offices have to report?
The individual providers actually will need to, document the information in Azalea, and then Azalea has its meaningful use dashboard, which actually calculates those numbers for you. So they will calculate the numerator and denominator for you in our system, and then the provider has to actually go to the CMS website and log in with their username and password that they registered with to report those numbers to CMS in order to participate.
I just realized we probably should follow up again with information on the meaningful use dashboard, and maybe in the email follow-up I'll include some information on that.
And Ashley, is that information located in the reports tab within the Azalea software to get to the meaningful use information?
Yes, Ramin, that is exactly correct. All you have to do is click on reports, and you'll see a tab labeled meaningful use. And when you click on that tab, you'll see a dashboard with each meaningful use measure and then a place for the numerator and denominator. So it'll show you in real time exactly where you are with meeting those requirements. And then there's a drop-down menu to choose either the stage 1 or stage 2 dashboard, depending on what you're reporting for.
All right, we've got some other good questions coming. All right, well, I don't know if we can answer this one. What are some of the differences that will be required for stage 3 for Medicare providers? Do we have enough information on that?
That is a very good question. I've actually, we just got, stage 2 certified, and I've got it on my to-do list to start researching stage 3. I know that they have not finalized anything yet, but as soon as they do, I plan to get started on that and get everything together to start making sure our EHR is certified for stage 3. But at this moment, I do not know exactly what they're proposing for stage 3. I just do know that they haven't finalized anything yet.
Right, correct. It's not finalized. So I'm going to also respond to whoever's asking this to kind of keep a watch on our blog and on our website for information for future webinars as we get that information finalized.
Yeah.
And Ashley, correct me if I'm wrong, but thankfully I don't think stage 3 starts until 2017. Is that correct?
That's correct, Ramin. At this moment, stage 3 will not begin until 2017. And that, and very well, we want to keep looking out for that because you never know, it could be extended. Changes happen all the time, but at this moment, stage 2 is extended until through the end of 2016, and stage 3 would not begin until 2017.
Right. Okay, I think we've got a couple more questions. All right, these are all good. All right, from our the question is, what if you attest in 2014 and pass? Will CMS wait to pay until 2015? And what is the time frame?
That's correct. We just talked about that one earlier. So in 2014, all of the payments for 2014 will go out in 2015, and that typically doesn't happen until the first payments that they start sending out. You usually won't see until the end of March, because CMS allows the providers to provide all of their information and a test online for 2014 until through the end of February of 2015.
And Ashley, would the exception be if they're attesting for Medicaid? Because Medicare, you're doing the 90 days. If this year was the first year that they purchased a EHR to attest for Medicaid, would they be able to receive payments this year then?
Unfortunately, I don't have a definite answer on that, just because it's up to the ONC as to their payout schedule. But they don't close the doors to even a test for Medicaid. Like, they don't close the deadline until February 2015. So I don't know if they ever send any payments out before they close the deadline.
All right, and a couple more questions. We're doing good here. We got some great questions.
Yeah.
The asker asked the question, I have attested both stages and passed. I now want to attest stage 2. Is that one that says stage 2? I can't read the whole question. But my patient portal is not compliant and will not be ready until January 2015. So I'm not really clear what the question is. Yeah. Can you comment on that, Ashley?
I'm thinking if they're ready to start stage 2, then they can start. If their patient portal won't be ready till 2015, then they'll just start their stage 2. They'll have to start stage 2 January of 2015, because starting in 2015, it has to be a full year of participation of stage 2. So as long as their patient portal is ready by January of 2015, then they could start their stage 2 in January.
And that's what it says. Will not be ready till January 2015. So they should be okay.
So they would do stage 2 year 1 in 2015 and stage 2 year 2 in 2016.
Oh boy, here's a long one. I don't know if I can read this one. All right, let's try it. Azalea has certain. Okay, hold on. Okay, oops, this may be out of scope. Are there measures we can attest yes for because Azalea has certain capabilities? For example, immunization registries, data submission, or maybe syndromic surveillance data submission?
That is correct. These are the yes or no measures. Some measures actually don't have a threshold percentage that you have to meet. You just have to attest yes or no that you have done the requirements. And for the immunization registries, I know stage 2 is a little bit different than stage 1. Under stage 1, you could attest yes for the immunization and the download syndromic surveillance, just because Azalea strictly was certified on those measures. But the difference between stage 1 and stage 2 now requires that you do ongoing data submission to these registries and that you've actually registered with them. And on our training site, there's a link to the list of registries in your area, and you would need to contact those registries and sign up with them, and they would take it from there to let you know what you would need to send them, the information to send them out of our system. And you can download it. It shows you exactly which buttons to click to download the information that they need, but you would have to actually take it an extra notch for stage 2 and register with these immunization registries in your area and send them that information.
Great. Okay, and here's another good question. If we opened a new office in August 2014, do we just do stage 1 for 2 years?
Yes, that is correct. So if you just opened an office, a practice, and you've never attested before, you would then do stage 1 for 2 years before you would move on to stage 2. And it just depends on when you begin. If you were able to start your first year in 2014, then you can have done October, November, December as your 3-month reporting period. But if you missed the boat to start in October, then you would start in 2015, and you could do January, February, March. However, the difference is in 2015, you're no longer going to be applicable for any incentive payouts under Medicare. If you're doing the Medicare program, you would only be just dodging the penalty at that point. But with Medicaid, you could actually, if you're eligible for the Medicaid program, you still have time to register for stage 1 in 2014 and just attest that you purchased a certified EHR.
Great. Thank you, Ashley. Okay, here's a Azalea specific question. How can we use the final dashboard numbers as documentation with our attestation if it cannot be printed? Are there plans to create a report?
Well, when you're attesting online, none of it actually has to be printed and submitted to CMS. Whenever you participate in the Meaningful Use program, you would go to the CMS registration site, and we have that link on our training site. We can also send out that CMS registration link in the email after this to everybody who may not have registered yet. And when you log in and register, and when you're ready to attest, you strictly just take those numbers from your dashboard that appear in the numerator and denominator column and enter them yourself. You type those numbers in. So you're pretty much just attesting based on the numbers in our system. And then should you ever be audited later down the road, those numbers will never change. You always go back to our dashboard, you enter the provider, the same reporting period, and those numbers will always be the same. So we could, take a screenshot of that if later down the road they needed to see those numbers, but when you're originally testing online, they strictly just require that you enter the numbers, and they take it from there. We'll take your word for it.
Thank you, Ashley. All right, well, okay, this one I think is going to test us. I'm not sure how we would interpret. If stage 2 is extended an extra year, as stage 3 will not start till 2017, will stage 2 in 2016 be for 365 days?
That is correct. If you do not start stage 2 until 2015, you would have to do stage 2 for 1 year in both 2015 and 1 year in 2016 as well. The only people who would get to do that 3-month reporting period under stage 2 would be those who were able to start in 2014. You could do October, November, December. If you wait till 2015, it would be 1 year, both years.
Oh, okay. This is a good question. We really haven't seen. What exemptions are there? For example, is my office too small? Do I exempt?
Can you repeat that question again, Tamara?
Yeah. Are there any exemptions to meaningful use? For example, my office is too small. Do I exempt? I don't think there are any.
I don't think there's any exemptions to the program overall. For every measure, for every objective, there is an exclusion, and if you fall under that exclusion when you're filling out your questionnaire online on CMS, you can check the exclusion. So, for example, for some of the objectives, it would say you have to meet, 50% of your threshold during this reporting period, and then it says, but if you see less than 100 patients or if you refer out less than 100 patients during your reporting period, you can exclude this measure. And you would just exclude that one measure out of the 17 core, for example. But I don't know if there's an exclusion available overall for an entire practice.
I haven't seen anything like that, yeah.
Actually, it might be good to remind what the to be included. So, and you correct me if I'm wrong, for Medicaid, as long as you take Medicare or Medicaid, you choose, if you accept both, which one fits your criteria. And again, for Medicaid, it's having a threshold of 30% of the patients on Medicaid. Again, if it's a pediatrician, it's 20%. And for Medicare, it is billing, not actually what you receive back from Medicare, but what is billable to Medicare as a threshold of $24,000. Those are really the two requirements. Is that correct, Ashley?
Yes, that's correct. You have to choose one program or the other if you're going to participate. The only way I guess you would exclude from the programs overall would be if you did not see Medicare and Medicaid patients and you only saw commercial. But, like Ramin said, the requirements would be you just decide which program then you're going to test with or participate in. And for Medicaid, you just have to meet a percentage threshold of how many patients, Medicaid patients you see, which would, like you said, would be 30. Unless you're a pediatrician, that would be 20. And the Medicare, it's not how much you actually receive, and it's how much you allowed that you, or billable charges that you billed out, which would be $24,000 to get that maximum payment.
All right, I'm gonna, one more question here. Do you register with CMS to attest stage 1?
Can you repeat that one more time, Tamara?
Do you register with CMS to attest stage 1?
Yes. What you do is you would register online with CMS, and once you register, I've never logged in personally myself because you have to have an NPI number. It's the same, and
right.
It's the same login you would have to the NPI registry to update your information online. But from what I've heard, when you log in, you register for one of the programs, either Medicaid or Medicare, and then you actually, once you're registered, you're registered. So then you just keep logging back into that portal to attest each year after your first year of stage 1. So that's where you go to enter all of those numbers and attest online.
All right. Okay. Now we had some other questions here that are a little more involved, so I'm going to encourage participants, if you need further clarification or want to discuss this, please give us a call. We had our phone number on here, and we'll get to that. Hold on. What's that coming down? I can't get it out. There we go. But you can reach out. And Ashley, do you mind if people reach out to you to have further questions on this?
Yeah, if you have any questions, we always recommend sending a message through our support in our messaging system. You just select the support group, and you can ask your questions, and we'll get back to you as soon as possible with any answers that we can help you with. And
we do know there's a lot of questions on meaningful use, and as you know from CMS, there's going to continue to be changes and clarifications, and we try to keep that information on our website and keep our customers informed on that. I also want to encourage everybody who's attending today, please let us know if this has been helpful, and if there are other topics you'd like to hear about in these webinars. We'd appreciate that feedback. Again, this will be recorded, and it will be available on our website. Probably next week I'll have it up. If you have any questions, send them to us, and thank you for joining us today. Have a good day. Bye.
Thank you, everyone.
Thank you.